It's a bad start to the day for paramedic Chris Boyle and his partner. He's been called to a dangerous job in a dangerous place.
Right, we've just got another emergency call. We're actually going to the Mersey Tunnel, one of the Mersey tunnels, for a two-vehicle RTA. Apparently there's 3 casualties.
Chris has been a paramedic for 13 years. This is only the 3rd time he's been called to the tunnel.
Hello, boss.
Hi.
Derek, are you hurting anywhere, mate? In your neck?
Yeah. Bit of pain in my chest.
Can we have a collar on just before we get him out?
Yeah.
He's just complaining of pain in his neck and a little bit of chest pain. It could be where he's probably gone forward and he's hit his chest on the steering wheel. Just come back now, down, Derek, okay? No, don't lift it.
Put the beneath my head. Sit up, my head's a lot more like. Let me sit up again, please. We can't. You must.
Just take it off. Come up, come up.
Derek should be strapped to a spinal board, but the pain in his chest is too severe to lie him flat.
Okay, mate. So just get you comfortable, get you up to the Royal, I get checked over.
How's my wife?
Yeah, I've seen it. As we turned up, she was
in agony.
She was getting up into the ambulance.
His wife Audrey is already on her way to the Royal, where Dr. Kate Clark is beginning her shift in resus.
It's looking very busy for a start of shift. We're full, we've got quite a few people waiting to be seen.
With the emergency department stretched, it's Sister Carmen Aspinall's job to keep it running smoothly.
Hopefully not many more patients will come in because we're really quite full. A&E the Royal, sister. OK, lovely, thank you. Bye-bye. Female from a high-speed collision, chest pain, GCS is 15, she's cannulated. So she could have some rib fractures, fractured breastbone, she could have some injury to her heart, lungs, all of which can be potentially fatal.
Audrey is rushed straight into resus.
Okay, just need to have a little feel of your tummy. Ideally, I'd lie you flat, but it's all around there. Is that sore when I'm pressing or sore in your chest?
It's on my chest.
I think you may well have cracked your breastbone. I'm also a bit worried about your chest on the right-hand side. They're all fairly serious injuries, yeah. She's going to have to be kept a close eye on to make sure she doesn't deteriorate.
When Derek arrives, Carmen and consultant Rob Eager are standing by.
Try not to shake your head.
Now, have you any pain in your chest or your tummy?
A bit of pain in my chest here.
Okay, what about the neck?
The neck's the main pain.
Neck is the main pain.
We are going to have to cut at some of your clothes, my sweetheart.
This is an expensive coat.
Well, with all due respect, Derek, your clothes can be replaced, sweetheart, but you can't be.
While Carmen and Rob treat Derek, Kate sends Audrey for an urgent CT scan of her heart.
My concern is that she's got no obvious rib fractures. The tenderness is all in the middle, and lying underneath her breastbone is a heart, big blood vessels connecting to the heart. And because she's got signs of some bruising to her chest and some bleeding on both sides of her chest with no rib fractures, we worry as to whether or not she's actually got some injury to her heart and the blood vessels around the heart. So it could be very serious.
You were going to see my wife, how is she?
She's got an injury to her chest, okay? We're going to have to proceed to do a scan of the chest and probably the tummy area as well.
Simon, eh?
Jason Sefton is a rapid response paramedic. He only goes to red calls, arriving on scene before the ambulance saves lives.
I've got an emergency come in. Unknown sex, unknown conscious, unknown breathing. Absolutely clueless what I'm going for. This could be literally anything in the world except something like, a submarine incident or something silly. Roger, thanks, received. Well, there you go. I'm going to a house fire, person's reported. We haven't got a house number yet in Coleridge Street. No doubt we'll sort of be able to guess which one it is. Be the one with the big red things outside. This is a regular haunt of ours. Oh, yeah. Taking everyone's out.
Just checking out. Check that flat there. Everyone's out there. There's supposed to be one person in that flat there.
We're always here.
At the moment. So this flat?
The bottom one here.
Okay, yeah.
As far as I know, they are derelict and empty, yeah. Just give them a first report to control. Let them know that the property is derelict. First report for you. If the property is derelict, derelict property. Smash him. Cheers. Thank you. Bye-bye. Bye. Right, so we're going to leave one vehicle running for now, only because, just precautionary. They just like us on scene more to make sure that they don't get injured.
Yeah, he's going into resus now because he's got a PCO2.
Can I have ECG and triage, please?
Wow. It's looking fairly busy at the moment.
The Royal Liverpool is a teaching hospital. Dr. Emir Khan is in his second foundation year.
It is fairly busy. It's fairly typical for a Monday, to be honest with you, but this is busier than normal.
His first patient is 26-year-old labourer Darren Grace, who's had an accident in the back of a van.
There was nails sticking out of the timber. That seems to be what I've gashed my eye on.
Right, let's just have a wee look at this. Okay, because it's on your eyebrow, I'm just going to put a couple of stitches in just so it comes together nicely, just for cosmetic reasons more than anything else.
You normally give an injection, don't you, to numb the pain before you stitch it?
Yeah.
I think the injection hurts more than the stitches.
Do you want to just go for the stitching?
I think I'll just go for the stitches without
What
the
a
injection.
brave man.
I feel a bit nervous.
No, don't be nervous, honestly. It'll be over in a matter of minutes.
Can I see the needle that you're going to sew me up with first?
Yes.
Yeah,
It is very small.
No, go for it.
Yeah, are you sure?
I'm sure.
Good lad.
Keep your eyes closed while you...
Absolutely, of course you can.
That's fine.
You're doing really well, Darren. Didn't even flinch. Pretty impressive. Well done, mate. I'm very impressed, Darren. If it was me, I'd go for all the anaesthetic I could get my hands on.
His stats are dropping
Are they?
in 3, yeah, but he's non-compliant with his O2. They were 94, 95 when he came in, they're 93 now.
Derek's condition is deteriorating. His x-rays show just how unstable he is.
But he has got a collapsed lung. So if it's not treated, it can cause significant breathing difficulties and can even be fatal.
Air trapped in Derek's chest cavity is preventing his lung from inflating, restricting the amount of oxygen reaching his blood.
It's the problem when you've got a lot of fatty tissue around. The trap just closes back in.
The trapped air is forced down the tube by the re-inflating lung.
Okay, can you just give me a cough, Mr. Street? Nice bubbles in there. Oh, right, that bubble's good. Well, now his lungs back up to normal, it means he'll be able to get more oxygen in his body. Unfortunately, I think it will probably increase the pain because it will cause the rib fractures to move. But we can give him painkillers for that. It means now he's in a position where we can move him and know that we don't have to worry about any major problems with the lungs.
Derek is now ready for a CT scan. The results of Audrey's show no life-threatening injuries. Phil O'Brien has been an ambulance technician since 1978. For the last 3.5 years, he's taken paramedic Andy Orme under his wing.
Well, he is like my dad, and he keeps telling me he's my dad. But show me dad.
I just said, did I know your mum as well? Did your mum go to cabin? Can you see the resemblance?
You see it now?
See that?
Their first shout of the day is to a diabetic, whose sudden erratic behaviour has alarmed his neighbour.
He's not in there. I'll have a forgot then.
Oh, God, I've just seen a dog. Did you call for an ambulance?
No,
Somebody said you did.
I did not.
What's your name?
Peter.
How do you feel, Peter?
Fine, thank you.
Hello, Ruby.
David.
Peter, come on back of the ambulance so we can have a chat with you and check you over. All right.
Hypoglycemic diabetics can appear to be drunk.
If you just leave me alone, let me go to bed. I bet if I go to sleep, I'll be fine.
We can't let you go to sleep, Peter, because if your blood sugars are low, what'll happen is you're going to a coma. And we can't have that, can we?
You know, like I'm pissed after being I'm pissed.
Have you been taking...
Like, I don't know why.
Do you know what day it is?
What day, yeah?
Yeah, what day is it?
Wednesday.
Wednesday. Today's Monday. You tell me, who's the Prime Minister?
Winston Churchill.
Winston Churchill. Is that a serious answer?
I am getting so pissed at my
Oh, no. This machine that we've got here, it measures the amount of sugar in his blood. Normally, you're looking between 5 and 7.
Baby.
As you can see there, his blood sugar's only 1.4, so they're very low.
What is it?
Your blood sugar's at 1.4.
No,
They are, mate.
What are you normally?
About
5. Straight, yeah.
At the moment, the confusion is as a result of the low blood sugar.
I agree with you.
What we need to do now, Peter, listen.
What?
We need to get some sugar into you. Peter, I want you to drink this, come on. Because we need to get serious now, Peter.
Yeah. Peter.
Otherwise, you're going to get worse.
Peter, drink the lot. I am normally fine with you. Yes, okay, leave Fuck off.
He's not really taking the sugar.
Peter, come on.
The other option we've got is to put a needle in and give him glucose through the needle. But in his state, I wouldn't even attempt it. Yeah, but it's just...
Why is that anyone in...
Peter, listen.
Not a minute, fucking good. I want to go to bed. Baby!
Listen, I'm too old for you.
Yeah, me too.
He's not that old, you know. It's very important to take Peter to the hospital because what will happen is his blood sugars will drop to a point where he'll collapse and basically people can die. That's the upshot. And I'm sure you'll thank us when it's all over.
Can I go home?
You'll be able to go home as soon as you've recovered, okay?
Mama?
Dr. Mark Buchanan has come on duty in Resus. 71-year-old Edward Gray's heart rate is just 29. It could stop at any moment.
How are you feeling, my friend? Feel lightheaded? No.
All right?
No.
We'll get you sorted out, my love, okay?
You've never had a heart attack? No. Angina? No. Diabetes? Epilepsy? No. You've never had any problems with your heart at all? Nothing, no. Just have the white bit off it.
As a precaution, defibrillator pads are put on Edward's chest. If needed, they can deliver an electric shock to keep the heart pumping.
I'm going to give something to see if I can speed it up. I'm going to give you some atropine. 100 micrograms in 10 mils. Let's give half of that.
Despite the atropine, Edward's heart stops.
Yeah. You're going to set up with that?
You'll be all right. Let's just bring him at the head of the bed.
With the defibrillator working as a pacemaker, Edward's heart rate is now back under control.
Right, are we actually catching now?
Yeah.
Basically, the heart was slow, but at least the heart was beating, and then what happened was that the bottom of the heart, the ventricles, stopped working. The top of the heart was working, but the bottom wasn't, which meant effectively he had no pulse. And what we were doing is actually, what I was trying to do, which worked, was try and force the heart to work by me pounding on his chest, while we basically set the actual defibrillator to take over the beat.
Just 20 minutes after Peter's had a glucose drip and a sandwich, Andy and Phil check on his recovery.
Oh my God, no.
Hello, Peter.
I am so How are you now?
Listen.
It's coming back slowly.
Peter, don't worry,
I'm
listen.
dead tired. I am
How are you, mate? You're
very
right.
nice. Oh yeah, I remember you as well. You know, I was just in there thinking now, I'll have to try and get Ruby around, right, send you a card or something, so I'm sorry, I'm definitely so ashamed tonight. More than what I think I've done.
The main thing is, well, Peter, everything's sorted out.
Thanks very much. I am grateful. Sorry if I'm bad.
No, listen.
I'm sure you get out of there again.
We'll see you soon.
Anyway, thanks very much.
See you, Peter.
Thank you. Very, no, really, seriously, very grateful. Where would I be without them? Between them and the neighbours ringing up, I'd still be on the floor now, or out cold. And God knows how long that would have lasted before I'd have been dead. Doesn't pay to live on their own. I think I'm going to have to go to sheltered accommodation.
A young child has reported a patient in Newsham Park with head injuries. Jason gets the call.
I have an emergency call come through. They've done a decent thing, and they've had the intelligence to ring 999. Daddy's not well, he's fallen over or whatever, he's hurt his head.
The problem is the child is very bad at directions, and a park this size doesn't help.
515 have come into the park. Any chance we can ring the caller back and get any more info? Over.
He said his name's Daniel. He's in the light blue tracksuit. And if he spots you, he's going to wave to you, over.
So you need a definitive description. I mean, as you know, the lakes are huge. Well, poor patient will be laying there on the floor now, and they've been there for a good 15, 20 minutes. Still nothing found. Over.
515, I'll call him back again.
All we can sort of do is keep our eyes peeled and sit and wait to be approached. Sounds great, doesn't it? Sitting in the park waiting to be approached.
1-5, I'm going to treat this as an MFC. He's taken the mickey now. He says he's by the police station. He's definitely not. And I can hear another kid whisper in the background. I'm going to stand you down on this.
Roger, thanks. Received it. So there you go, an MFC, malicious false call, a child messing about. Frustrating and upsetting because, I mean, the vehicle's been off the road. I mean, if a child, say, for instance, in South Liverpool now, wasn't breathing, there's no ambulance to send to that child because it's here in Nugent Park looking on a false call.
Amir has picked up Thomas Grady's details. He's another builder.
I've got a 38-year-old chap here who looked like he was drilling at work. The drill slipped and he's drilled into his left hand. I think it sounds quite painful, doesn't it?
My pen?
No, I haven't.
Yes, you have.
I've had it for ages.
It is. It's yours. Squidgy top. I want that back.
But it's my favourite pen.
You must have acquired that.
I think I might have done. Hi, Thomas Grady. Hi, my name's Amir. I'm one of the doctors here. Did it come right through and out the other side, or just...
Well, it hasn't popped out on the end, yeah.
Okay. Right, let's have a wee look at this, shall we? Okie dokie.
Boy.
How much movement have you got in your fingers there? That's about it. Can you feel me doing this?
Not really on the middle one.
This one? It doesn't look like there's anything left behind. Normally, if there is particularly a metal object left behind, it stands out like a sore thumb. Excuse the pun. That's a bad joke. I'm just going to run it by Alan, one of the registrars as well. The only thing I was concerned about was he's complaining of reduced sensation in his middle finger.
Where's the drill gone through?
Here.
And he's got reduced sensation to this finger. Okay.
But things like that, when I'm just a little bit worried about the sensation in his fingers, I just want to run it by a senior to make sure there's no damage. I just want to make absolutely certain, because it's his hand and it's his livelihood, so we should really make sure.
Because that's right where the nerve is, even though you're not in the right place, it's probably worthwhile that we speak to the plastics people across at Wiston.
You'll go back to work tomorrow?
I don't think so, no. Not for a while until this is healed up properly.
Okay.
Right,
See you now. Bye-bye.
Well, it started out busy, it went nice, and then in the last 30 minutes we've had 5 people book in. We've got a young girl, she's fallen over and dislocated her thumb. Normally people sort of can dislocate the thumb, move it out of joint a little bit, but hers is just completely in the wrong position.
17-year-old Katie Finnegan needs her thumb pulling back into place.
She's got some local anaesthetic in, so it's nice and normal. I'm going to give it a really good tug, see if we can manage to get it back into a normal position.
Push it up, that's what I was trying to do. Yeah. All right, Katie, we're going to stop.
It's moved a bit, but it's still something stuck in the joint.
Anything there, Katie? You all right? Just try and relax your arm.
Something just caught on the end of it.
Katie,
Okay.
just keep moving there.
All right, you're nearly done. Just keep taking nice big deep breaths. You're doing great. Is it really very sore, Katie? Yeah. Okay. What's happened is when it dislocated, the bone sort of went like this. We've managed to pull it up, but what's happening is that we're getting it up here, and normally what should happen is that it just slips on top. But it feels like there's something actually stuck in the joint, because you can pull it up like this, but we can't actually get it to slip across and go into the joint. Unfortunately, what this means, I was going to have to actually put her to sleep, and she's going to have to go to theatre. She's been very brave.
It's Jason's final call of his shift. Cecilia Chibesa, who is 8 months pregnant, has collapsed in the street.
I'm guessing it's something to do with this. Hello, hon. What have you done? Hey. Can you talk to me at all? Has she spoken to anyone at all?
No, just
the way she is now, fighting for that.
Oh, it's coming to us as a fall, but I mean, she's hyperventilated, so whether she's hyperventilated to the point of collapse, we don't know yet. What have you done to yourself? Well, come on. What have you done? Have you fallen over or you just fell? Try and keep your breathing nice and slow, come. You're still breathing far too fast. It's not good. It's not good for you.
I was coming down the street, seen her lying on the floor, stopped, and there was a gang of these kids that are always getting condemned, hanging about on the street corner, and they lifted her into the cab so gently, without them she'd have still been lying on the floor. They're the kids who need the thanks, not me.
Because you're knocked out. Honey, I can't help you unless you tell me things you know. Hey? Do you know how many weeks you're on?
35.
Sorry, hon.
35.
35. And just keep control of it and out. What we're going to do, put her in the vehicle. It's light, it's warm, and it's private. We can have a good look at her. We can have a really good chat with her. That's it, hon. I mean, the lady, she was so shook up by it all, wasn't she? I mean, she was hyperventilating, she wasn't speaking, she wasn't able to tell us anything. I mean, we can't guess. First thing we have to do is calm the lady down and, you know, be really, really gentle with her. Hopefully she'll be okay. That is me, finished and out of here. Right, it is, what? 1911 now, so it's 11 minutes ago finished. We had a bit of a bad day, actually, didn't we? Oh, you know.
Prolonged drug abuse has left Ray Shacklady with a deep vein thrombosis.
Big deep breath in and out. Now, one of the problems with a DVT, deep vein thrombosis, is that pieces of the clot can shoot off, land in the lung, which, if that's a large clot, can actually be life-threatening. If we give you an anti-clotting drug, then that actually will stop things getting worse.
Ray is on a drug rehabilitation program.
I just had enough. 17 and a half years was too long. I've had enough. The lifestyle I led, the drugs I took, what I did to get the drugs. There's so many people who want to come off drugs, and so many people are off them and staying clean through the NA fellowship. So if it can work for them, it can work for me. When I leave the programme, I'll have a little place set up for myself, flat, bit of voluntary work, and hopefully come back into the field and support other addicts.
He'll definitely be staying in tonight. I think he needs quite a few investigations to find out what's going on. I think these are some of the investigations maybe should have been done in the past, but because he wasn't in a state where he'd want to stay in or be investigated, he never gave us that chance.
I know a lot of people who've died from drugs. I've had a second chance. I hate it. I've wasted my life. Wasted it. Killed part of my body and wasted my life.
They responded to an assault outside of a public house in the Liverpool 4 district. And the patient is in a chip shop close to the public house. He's being battered. And he has been battered.
Responding to violent situations can put ambulance crews in danger. Last year on Merseyside, there were 86 assaults on paramedics while on duty.
Pour him his head, blood there, mate, down there.
All right, mate, we'll sort it.
Whoa.
Back, yeah, police being called.
Get you onto the ambulance. We need to get you outside and onto the ambulance so we can look at you. Okay.
23-year-old Gumle Chen was attacked outside his chip shop.
Yeah. Come back a bit for me and put your feet up. Take that off for me. Were you knocked out at all? Do you remember everything? Yeah. You do remember everything?
It looks like he's broke his nose.
But it looks like the nose has got nerves.
Yeah, he's cracked a bit of his nose.
Yeah, sort of come up. Is the pain around this area here? Whereabouts? At the back? Did you fall backwards?
Yeah.
You never banged your head on the floor?
No, I just banged in the window, then fall over.
Is it painful to touch?
No.
It's not? You must probably X-ray him anyway when you get him in. Give him a good check. You just feel a bit sorry for people who run businesses like this. They do a good job. You get people who just take advantage of it and are allowed to get away with it. better. Put your feet up. He'll be observed for a while, I should imagine. They might keep him in overnight, possibly, just to observe him and see if there's any reaction.
Well, he's going to live to fry another day.
To fry?
To fry another day.
Oh, yeah. He's on form tonight, isn't he? He's a chip off the old block. A chip off the old block.
Oh, I like that one, yeah.
Contact reception, please.
David Catley is losing blood from a cut wrist. Mark must stem the flow.
Sorry, mate, I'm really, really sorry. What happens when you've got an artery that you've cut through is it spasms and it closes off, which is what we want. Very occasionally it does this, so it only means that we need to put pressure on it to get it to stop. We've certainly got quite a lot of splatter down here. So you were trying to break into your house?
I sort of like tried to smash the glass and just like the forearm just went right across.
That's a nasty cut there. Okay, what we've got here is almost certainly a laceration through your artery. If you can see in there, it's actually pulsing. That's the actual ulnar artery that you've gone through, some of your tendons as well. Can you feel me touch you there? Can't feel me touch you there.
Sort of numb.
Can you feel me touch you there?
Numb.
Bring your thumb up for me. Can you bring your wrist back like that? And keep it there, okay? Stop me pushing it forward. Push against me. Doing fine. Okay, spread your fingers really wide. It's the best cut I've seen for a while. This is going to need to go to Whiston, where they have the plastic surgeons. They're going to need to take him sort of as quickly as we can stabilise him, really. I'm not going to do anything to the cut. I'm just going to make sure there's pressure on it so that it doesn't bleed any further. It's been a pretty awful night. It's been extremely, extremely, extremely busy with very, 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 very sick patients. But well, that's what I like about emergency medicine.
After surgery, David's recovered 75% movement in his hand. Audrey spent 12 days in the Royal with a broken hand, cracked sternum and a bruised heart. Derek still suffers the effects of whiplash and his lung is not fully inflated yet. Cecilia's baby was born 1 month later with no further complications. And Edward's heart stopped again before he was fitted with a pacemaker. He's now at home and feeling fine.